Alright, so today we will be starting with digestive pharmacology. Okay, so this is the first lecture, digestive pharmacology of veterinary pharmacology and toxicology, third year BVSc and AH. So let's start. So in any system, there are various classes of drugs which act on digestive system. Okay, the first class of drug which we will be covering in this lecture is this drugs affecting salivary secretions. Okay, so there are similar drugs, for example, drugs affecting gastric secretion, etc. Drugs affecting gastric motility, all of these drugs. Okay, we are starting with these drugs affecting salivary secretions. Okay, so it includes two types of drugs: salivary stimulants, also called Cialis, and salivary inhibitors, also called anti-Cialis. Okay, so we're starting with salivary stimulants. All right. So if we start with salivary stimulants, then salivary stimulants are also called cialogogues. Okay, these are also called cialogogues, and salivary stimulants or Cialis or cialogogues. So these are the drugs which are used to increase the volume and fluidity of saliva. Okay, what are cialogogues? These are the drugs which are used to increase the volume and fluidity of saliva. Okay, all right. Now, if we talk about the clinical uses, so you might ask that what is the clinical use of Cialis or cialogogues or salivary stimulant? So their clinical use is to treat hypothyroidism. Okay, hypothyroidism, that is decreased salivary flow, because ptyalin is the enzyme found in saliva. Okay, and hypothyroidism leads to xerostomia. So xerostomia, that is the condition of dry mouth. So to treat these two conditions, or this is a symptom, this is a sign of xerostomia, is a sign of hypothyroidism. So to treat xerostomia or hypothyroidism for overall, so we need Cialis or cialogogues. Okay. Now let's study the classification of Cialis or cialogogues. So Cialis or cialogogues are classified into two classes: indirect acting Cialis and direct acting Cialis. Okay. So indirect acting Cialis include drugs like gentian, Nux vomica, quassia, and direct acting Cialis include drugs like carbachol, ericoline, all of these. Okay. Now we're studying the definition of indirect acting Cialis. We'll be understanding what these two are, and we'll be studying the mechanism of action in detail. Okay. So now the topic is indirect acting Cialis. So indirect acting Cialis are also called bitters because they have a bitter taste, and reflex acting Cialis because they act reflexively. So I will explain this while explaining the mechanism of action of indirect acting Cialis. Okay. So what are indirect acting Cialis? Indirect acting Cialis. So these are the vegetable drugs that is obtained from plants which stimulate taste buds on the tongue due to their mild irritant action, thus produce increased salivation. Okay. So very easy, these are drugs which are obtained from plants, as these are vegetable drugs which stimulate taste buds on the tongue, and they are able to stimulate taste buds on the tongue because they have a mild irritant action, and thus they produce an increased flow of saliva, because irritation is kind of a noxious stimuli. So when a kind of noxious stimuli is present or provided to the taste buds, so obviously this will lead to, or any portion of buccal mucosa for the matter of fact, this will lead to increased salivation. Okay. So now what is the mechanism of action? How they do these act? Okay. So let me just take another notebook and I will explain using that. Oh. So this is the notebook, and I will be explaining using this. So I had made some notes for this. Yeah, these. So these are the reflex acting Cialis. Okay. So reflex acting Cialis, what they do is, let me explain all of this. Okay. So reflex acting Cialis, these are the drugs which act by increasing the flow of saliva by stimulating natural salivary reflex mechanism. That is why they are called reflex acting Cialis. Okay. Alright. So what happens here is, when these drugs are administered, so what they will do is they have an irritant or bitter action on the taste buds, so they will stimulate the taste buds. So this will lead to generation of some sensory impulses. These sensory impulses will be taken from by the facial nerve, that is 7th cranial nerve, to the medulla oblongata, that is brainstem, and when that will be taken in the brainstem, that information or sensory impulse will be processed. After processing, the brain will send these impulses back to the salivary glands via parasympathetic fibers. Okay. So parasympathetic fibers releases ACH. As you know, parasympathetic fiber release acetylcholine, because parasympathetic fiber are taking or carrying the impulses back to the salivary glands. So ACH will be released, and as you know, salivary gland contain two types of receptor, M3 and beta 2. So beta 2, that is an adrenergic receptor, that is not of our use right now. So M3 receptor are responsible for increasing the salivary secretions. Okay. So salivary secretion will be increased when acetylcholine will bind to M3 receptors, and this will increase the flow of saliva, production of saliva. Alright. So that is the mechanism of action of this. Alright. So now one point which you need to keep in mind is that the long-term use of bitters is avoided. Okay, the long-term use of bitters is avoided because they cause gastric disturbances for example, gastric ulcers. Okay, so the time for which we can, average time for which we can administer these indirect acting Cialis is 7 days or 1 week. No, not more than 7 days. Okay, all right. Now we'll talk about direct acting Cialis. So direct acting Cialis, these are drugs which directly stimulate the salivary glands to produce an increased flow of saliva. As the name suggests, direct acting, they will be acting directly on the receptors of the salivary gland present on the salivary gland to increase the flow of saliva. Okay, mechanism of action is as follows. So we know salivary glands contain M3 and beta 2 receptor. The function of M3 receptor includes to increase the production of saliva and beta 2 to decrease the flow of saliva. So what they do is these stimulate M3 receptors. Okay, direct acting Cialis stimulate M3 receptors. So when M3 receptors are stimulated, this will lead to the contraction, increase in contraction of salivary muscles, and this will lead to the increased flow of or production of saliva. Alright. Now we move on to salivary inhibitors or anti-Cialics, also called anti-Cialagogues or salivary suppressants. Okay. Alright. So these are the drugs which decrease the flow or fluidity of or production of saliva. Okay. What are salivary suppressants or anti-Cialagogues or anti-Cialics or salivary inhibitors? These are drugs, obviously anti-Cialics, so they will be performing the function opposite to that of Cialics. So these will be inhibiting the production of saliva or flow of saliva. Okay. So now these are used in all types of surgery as a pre-anesthetic medication. This is the use of anti-Cialics, mainly used. They are used as a pre-anesthetic medication in various types of surgeries. Okay, because they suppress the secretion from all these glands. For example, salivary gland, bronchial glands, all of these glands, the secretion will be suppressed. So this will lead to, this will help in aid in surgery because there will be no secretion, so surgeons can easily perform the surgery in animals. Okay. So the drugs included under, there is no classification of anti-Cialics or Cialagogues. Anti-Cialagogues, the drugs included are atropine, hyoscine, glycopyrronium. Now, let us understand the mechanism of action. These three have same mechanism of action. We will understand by taking the drug atropine. Alright. First of all, atropine, what it does is, this atropine or these three drugs, all these three drugs act by acting as an antagonist of M3 receptor. Okay, so as we discussed in here that M3 receptors are responsible for increasing the flow of saliva. So they will act as an antagonist to M3 receptor. They will bind to M3 receptor. Then ACH, which is released from the parasympathetic nerve fibers, then that ACH will not be able to bind to the M3 receptor. So there will be no increase in flow of saliva. Thus salivary production will be decreased. Okay. So hyoscine, this drug is given in motion sickness in humans or in animals. Okay? I don't know what animals in motion sickness seen. I think that is seen in animals. Okay. So that is, now one point you need to learn is clinical point that atropine and hyoscine is not used in horses or equines because they cross the blood-brain barrier, causes myelitis, so they cause central nervous systems symptoms. Okay. So thank you.